Kim Ogg, Harris County District Attorney. I'm joined today by Dr. Kara Breeden of Texas F&E Forensic Center for Excellence, and also by Allie Jacobs of the UTMB Center for Violence Prevention. We're here because the District Attorney's Office, through our Asset Forfeiture Division, is contributing $269,000 to the Forensic Center for Excellence to an adult forensic interview program that is being expanded. Now, what is adult forensic interviewing? It is the process of eliciting accurate and reliable information from crime victims through a structured interview process with the goal of gathering it in a sensitive, ethical, and legally defensible manner. At this time, the Sex and Human Trafficking Division, Sex Crimes and Human Trafficking Division, has 844 pending adult sexual assault cases. Would the prosecutors and the support staff from that division please raise your hands so they know who you are? All right. I want to personally thank these lawyers for the work that they do. These are some of our most difficult violent crime cases. And of course, I want to thank the Asset Forfeiture Division for taking money from human traffickers and drug dealers to support crime victims. It is the perfect way to reinvest criminal asset forfeiture funds. You know, if we have 844 pending cases, that represents nearly as many real people who are crime victims, who are awaiting their day in court and awaiting justice. And those cases have all been investigated by law enforcement and are now being prosecuted by our office. But we all know that the crime of rape is probably the most invasive, intimidating, and one of the most damaging violent offenses that can be committed against another human being. It's a very damaging thing. And unfortunately, historically, the investigative interview process itself was invasive, intimidating, and caused potential secondary trauma to those same crime victims. But it doesn't have to. And Dr. Breeden and her staff, she's joined by them today, from the Forensic Center for Excellence, have created a cutting-edge protocol for dealing with the interview process of adult sex crimes victims. Minute of history here for everybody. You know, the investigative process for child rape victims changed back in the 90s, 30 years ago, with the development of the Children's Assessment Center, which now provides us the most trauma-informed investigative process for rape victims under 17 in the nation. But it left a huge gap for adult victims. And that's why when Texas F&E stepped forward with this new protocol of handling adult victims much the same way that child sexual assault victims were being handled, through trained, trauma-informed processes designed to get better testimony, more accurate and effective evidence against perpetrators, they changed the game. And that's why the District Attorney's Office has funded this project from the very beginning. So this $269,000 is our continuing reinvestment in crime victims. And our goal is to increase reporting of the most underreported violent crime in the world. And as the daughter of a kidnap victim who was taken when she was 21 by force by a serial rapist from a downtown location and driven off, kidnapped, who saved her own life by jumping out of the car, I just have to tell you, there were no services for people like my mother, who was 21, who went back to work, but not for long. And I would say that the effect of just the kidnapping without the intended rape was enough to change not only her life, but my entire family's life and my personal trajectory. So what I would say to those out there in this holiday season, that it's easy to be taken advantage of. It's very important to be vigilant. But if the worst happens and you are assaulted, it is safe to report. It is important to report, because absent your report, that perpetrator will just go on, in all likelihood, to create more crime victims. So I want to thank Dr. Breeden. Allie, I can't wait to hear about the results of your study on the program itself. And I think the community owes Texas F&E and the Forensic Center for Excellence, our prosecutors, law enforcement, the individuals in this county who are dedicated to serving sexual assault victims. I think we owe them a big thanks, and it's just about time that we supported them monetarily. So, Kara?
Thank you so much. I am Dr. Kara Breeden. I'm the founder and CEO of Texas Forensic Nurse Examiners, the Forensic Center of Excellence. The Forensic Center launched in 2019 as a community-based forensic nursing program with the goal originally of expanding access to medical forensic exams, or in other words, rape kits, for victims of sexual assault and other types of violence. It was important to us to provide access for these exams for victims of other types of traumas as well, such as domestic violence, trafficking, and other forms of abuse. I was not a person that had experience at the time leading and certainly not creating a nonprofit organization. It was just something that I felt very passionate about, as I had encountered the frustration of how patients felt after being turned away, transferred, or told to go somewhere else for what our organization feels like is a basic human right. As a nurse, I felt hospitals generally wanted to be able to provide the service for these patients, but it is complicated. It is truly a specialty in the nursing profession. We felt that if we could centralize this service and offer this to hospitals, that they would want to be able to provide this for the patients that walked through their doors. Today, almost 5 years into this endeavor, we have over 60 hospital partners in Harris and surrounding counties. Our partners include people like HCA, CHI St. Luke's, MD Anderson, Oak Bend, Methodist in the Woodlands, Patients Emergency Room, Texas Emergency Hospitals, and several others. We really wanted to make sure that wherever a patient walked through those doors in their community, they were able to receive services. This year, we have launched 2 satellite programs, one in the Rio Grande Valley and one in the North Texas, Dallas region. In 2019, when we were launched, we were able to provide 358 medical forensic exams for victims of violence. Today, in 2023, we are projected to conduct over 2,100 exams for victims of violence. As a nurse, before starting the Forensic Center, I really didn't have an understanding of the criminal justice system that I do now. I really thought that as a nurse, I would do the exam, the law enforcement would pick it up, and they would take the kit to the crime lab, and then the case would go to court, and we would get justice. Our victims that we served would have the justice that they needed. But obviously, years in, I realized this is a much more complicated process with a lot of moving parts. In the fall of 2019, I was talking with a prosecutor from DA Ogg's office, and we were dreaming about how to improve the experience victims have after they are a victim of a crime, such as trafficking, sexual assault, domestic violence. She introduced the concept of an adult forensic interview, which I had never heard of. She called me roughly 3 months later and said, "Hey, DA Ogg she wants to do this program. Can you run it? Can you do it?" And I was like, "Sure, let's do it. I don't know what this is going to look like, but I'm ready to take this on. If it's going to make a difference for victims of violence, let's do it." So we went down a very long path of learning, trying to figure out what this protocol was going to look like, how to serve victims in the best way that we could. And we ended up here with an amazing staff and program that I'm very proud of today. It has been such an honor to develop such a meaningful program that really and truly did not exist before DA Ogg made it a reality. In case you're not familiar, in the 1990s, the concept of a forensic interview was introduced for children. It was clear that children needed a safe and neutral space to be able to share their trauma that they had experienced. 1990. This was over 30 years ago. So it's taken us 30 years to get to a place where we think that adult victims of crime, mostly women, also deserve a safe place to share their experiences. Before the AFI program, victims of violence talked through their experiences of sexual assault and other types of crime with law enforcement. Law enforcement are generally great people, and they want to do their jobs well, as most professionals do. But law enforcement are very skilled at interrogating suspects. They don't all have training on how to talk to victims of trauma. They generally are wearing a gun on their hip, and many times the interviews are conducted in a space similar to where a suspect is going to be interviewed. The Forensic Center launched the AFI program in June of 2020, thanks to DA Ogg. The interviewers are all individuals who have a previous experience and background in working with victims of crime. That was really important to us as an organization when we launched the program. The interviews are conducted in a safe space where basic needs like food and comfort are considered first. Interviews are conducted in collaboration with law enforcement or the DA's office. We are working together to change the experience for survivors of crime and working towards ensuring that victims aren't re-traumatized by their experience of sharing what has happened to them. Since the program launched in 2020, the team has conducted more than 1,900 interviews. The support of DA Ogg with this program has made such an impact on the community and these survivors. I am forever grateful for that. In 2022, the team conducted 543 interviews with 2 interviewers. In 2023, we are projected to conduct over 615 interviews. This is a 13% increase in 1 year, which demonstrates the community's acceptance of this program and the need for the expansion. To date, we have worked with over 44 different law enforcement agencies and have conducted interviews in 12 different languages. To be able to provide a space for victims to talk about their experience in their own language is such an honor, and we thank our partners like Masterword and other donors that have helped make that possible. I can't talk about the AFI program without acknowledging my amazing team. Thank you for your dedication to the victims that we serve. We are forever grateful for DA Ogg's continued support of this program and look forward to another year of growth and positive impact for survivors of violence. The Forensic Center felt like it was important to evaluate the experiences of survivors and our community partners to ensure that what we thought was great work really was great work. We interviewed several research teams and decided the team with Dr. Leela Wood at UTMB were the best fit. I will let Allie Jacobs with the UTMB research team talk about what they found with their evaluation of the AFI program.
So thank you, District Attorney Ogg, and thank you, Dr. Vreeden, for the work that you are both doing and will continue to do for survivors. My name is Allie Jacobs. I am a longtime advocate for survivors of interpersonal violence and a research program manager at the University of Texas Medical Branch Center for Violence Prevention. I am here on behalf of Dr. Leela Wood, the research lead for the evaluation of the TXF&E Forensic Interviewing Project. Unfortunately, Dr. Wood could not make it today because of family obligations, but I am honored to be here sharing this statement on her behalf. In the last decade, the use of forensic approaches have expanded beyond medical exams, with adult victims of interpersonal violence like sexual assault and human trafficking being invited to participate in forensic interviews with trained, neutral third parties. Innovative agencies like TXF&E have begun to apply this model, which we previously utilized with children only, to adult victims of interpersonal violence in Harris and surrounding communities. However, very little research has been done to understand victim and stakeholder experiences and to assess potential outcomes of the adult forensic interviewing programs. To address this research gap and to improve their own practices, TXF&E partnered with our team at the Center for Violence Prevention to conduct an initial evaluation to understand the AFI process, participant experiences, and assess for potential outcomes. TXF&E is one of the very few agencies across the country providing this service, so we were beyond excited for this collaboration. For our project, we interviewed 24 TXF&E staff and community partners, including members of law enforcement and attorneys. We also interviewed 15 AFI participants, and participants are victims or witnesses of a crime who have participated in the adult forensic interview at TXF&E, in addition to conducting surveys with 38 more participants. We also analyzed interview transcripts, program materials, and AFI data from fiscal year 2022. From our evaluation activities, we were able to understand AFI participant experiences, staff and stakeholder perspectives, and develop a logic model or framework for understanding potential outcomes of this practice at TXF&E. Through our evaluation activities, we learned that the goals of AFI at TXF&E are, first, to use trauma-informed interviewing skills and strategies that collect high-quality information for an investigation of a potential crime that reduces or eliminates the need for additional interviews, and second, to provide a safe, low-barrier access space for victims and witnesses of a potential crime to receive objective information and support. The focus on eliminating the need for additional victim interviews recognizes the potential for additional trauma for victims by repeated interviews. The neutral, safe, third-party approach utilized by TXF&E centers the comfort of the participant, while collaborating with law enforcement to collect a victim statement for the investigation. In our interviews, we found that participants experienced TXF&E staff to be warm and trauma-informed. As one of the AFI participants said to our team, "The interviewer at TXF&E, definitely 10 out of 10. One thing she said to me was, 'This is an investigation, never interrogation,' which made me feel a whole lot better about the forensic interview in the first place." A different participant interviewed for this project also showed how welcoming her interviewer was at TXF&E. She said the interview was really nice, really comforting, really inviting. She made sure I was okay the whole time. Our evaluation activities indicated that the adult forensic interviewing at TXF&E is a highly reliable implemented service. A total of 360 AFIs were conducted in fiscal year 2022 at TXF&E. The most common type of victimization reported during an AFI was sexual assault. However, nearly half of those participants reported more than one type of victimization. 28 unique Texas investigative agencies utilized the AFI service, as well as 3 out-of-state agencies and the FBI. This indicates the forensic interviews are accessible and useful. After forensic interviews are completed, TXF&E offers advocacy services to victims, which can include information about referrals and resources in their community. This is a service over 30% of AFI participants utilized. Previous research has repeatedly indicated that the use of an advocate helps improve victim safety, health, and economic outcomes. So the success TXF&E has in linking victims to an advocate is particularly promising for victim outcomes. Our evaluation indicated that adult forensic interviewing is highly useful to professionals in the criminal justice system, including law enforcement and prosecutors. Stakeholder interviews indicate that law enforcement and legal counsel use the FI to identify additional evidence to pursue, influence charging decisions, enhance the understanding of a case, and aid in case planning. While we did not conduct an outcome evaluation of the AFI program because time constraints, our initial evaluation indicates several important potential outcomes of the AFI program at TXF&E. The first potential outcome is the reduced number of victim interviews. Evaluation data suggests that AFIs at TXF&E typically result in minimal subsequent interviewing from law enforcement, which is better for victim trauma recovery and health. We found that AFIs increased victim engagement in the criminal justice system by providing a safe and neutral place for the investigation interview. We found that with increased victim comfort and engagement, the quality of the information and evidence provided in the interview is improved. The reliable structure of the AFI, partnered with law enforcement collaboration, leads to more in-depth and helpful evidence collection. This improved evidence helps to build better cases with the potential for more offender accountability and improved community safety. In some cases, the AFI has helped to link cases with serial or repeated offenders. Finally, one of the most consistent and enduring benefits of the forensic interview is the educational impact with members of the criminal justice system on trauma-informed approaches with victims. By observing neutral and patient questioning approaches, law enforcement and prosecutors gain insight into more impactful ways to engage with victims that reduces their risk for re-traumatization and increases rapport. In summary, through our initial evaluation, we found several potential positive outcomes for the AFI program at TXF&E that indicate the program benefits victims of crime and the pursuit of justice in our area. We look forward to future outcome evaluations to examine this promising model and thank TXF&E for our collaboration and service to victims of crime. We welcome the funding opportunity by the Harris County District Attorney's Office to TXF&E to continue their programming. Thank you.
Allie, Dr. Breeden, thank you so much. If you will, before we open it up to any questions, would you all just help me thank the nurses, the prosecutors, the support staff, the forensic interviewers, the leadership of the Harris County DA's office, and the asset forfeiture group for changing our world for the better. It's not that hard. It just takes willingness to try and help, try new things, evaluate them, see if they work, and if they do, let's do more of it. We need this crime reported so that there are fewer predators out there among us. So, everyone, thank you. And we're good. We're just going to get a quick photo op. And would you all please, in fact, why don't we just come to you? That's probably easier.